Good evening, everyone. I am Ashwini. Welcome to this webinar on varicose veins. Many senior citizens have varicose veins. These are some these are sometimes swollen and twisted and often result from weakened valves in the veins, commonly due to aging, leading to discomfort and potential complications. Today, we have an expert from Manipal Hospital to take us through the condition of various varicose veins, its causes, prevention, and treatment options. This will empower you and enable to make informed decisions about your health. I am immensely pleased to introduce today's expert speaker, Dr. Narendra Reddy, Senior Consultant at Manipal Hospital. Dr. Narendra Kumar Reddy did his MBBS from the Kempegowda Institute of Medical Sciences, Bengaluru, MS in General Surgery from Bangalore Medical College, and his FVES in Vascular and Endovascular Surgery from Manipal University. After gaining proficiency in the entire spectrum of general surgery, Dr. Narendra Kumar Reddy has been concentrating throughout his career on renal surgeries, laparoscopic, and endovascular surgeries. He has presented papers at both state and national level conferences. He has also attended the various conferences conducted by the Society of American Gastrointestinal and Endoscopic Surgeons held in New York. With over 30 years of experience, Dr. Narendra Kumar Reddy has acquired immense knowledge and experience in handling even the most complicated laparoscopic and vascular and endovascular surgeries. He has also has vast experience in diabetic foot management and podiatry. Doctor, thank you for accepting our invitation to talk to our members. Over to you.
Computer, so as you might have guessed. So I'm Dr. Narendra Reddy. I'm a consultant vascular surgeon from Manipal Hospital, Varthur. Today I'll be talking about a topic that is of interest to most of us who are turning 60 and are going to grow above 60. So we would have come across people who have dilated veins in their legs, or you might have seen some relatives or family members who have this problem. I'll be talking to you about the varicose veins today. So, as Leonardo da Vinci said, the human foot is a masterpiece of engineering and it is a work of art and it should be treated as such. So, most of us, as we grow older, will have some kind of pain in our legs. We will have leg pains, and we doctors like to differentiate pains in our legs into 4 or 5 different causes. One is a vascular pain, that is either the arterial blocks or the vein blocks. Next will be the neurological pains where the nerves get impinged. And then we have the common pains, which are the musculoskeletal pains, and then infections. Coming to vascular pains, it is usually blocks in the arteries that are run down to the legs, what is called as a peripheral vascular disease. So the second cause of pain in the legs, the vascular cause will be varicose veins, which I will be talking to you more in detail. And again, if there are clots in the veins that are deep in the muscles, those are deep vein thrombosis, they too can cause pains in the legs. The second most common pains will be the neurological pains when you have a nerve that runs down the back. If it gets pinched by the bones, by the back bones, then you can get severe pain running down the leg. And then you have, if diabetic patients might suffer from a disease called as a neuropathy, as the diabetic neuropathy. And sciatica is a pain that runs down the back of the leg, coming from the back. And then you have common musculoskeletal pains such as arthritis, fractures and sprains when we fall down, and then infections that can cause pain in the legs. I will be talking about varicose veins today, but feel free to ask me about the other causes of pain that you're seeing in front of the screen. If I'm able to answer them, I will answer them. So, what are varicose veins? So, most of you would have seen the legs that I have presented in this picture, either in the fields or people working in the fields, or someone that you might know might be having this kind of unsightly, ugly veins that run down their leg. By definition, they are dilated, that is, they are swollen and twisted veins that run in the leg, mostly in the legs, and that are visible usually under the skin. This meeting is being recorded. They usually run under the skin, and varicose veins usually occur when the valves that run in the leg, they don't work properly, they don't allow blood to flow back into the chest, into circulation, and then they cause the blood to pool in the legs, and then they cause the kind of discoloration you see in the figure B. So, who is prone to get varicose veins? So, they are very common in the society. About 15% of adult population, up to 20% of adult population suffer from some kind of venous disorders. Not all of them can be classified as varicose veins. Some of them are what we call as venous insufficiency. So these are the main risk factors for varicose veins. Genetics play a very large role. So there are people who come with varicose veins, who have varicose veins in their family, their mother, their father, their grandfathers could have had varicose veins. Approximately 20% of varicose veins are genetic, they are hereditary, they run in families, approximately 20 to 25%. Again, people who work long standing, such as farmers, doctors such as myself, nurses, people who work in factories, police people, military people who stand for long time, security people, they are prone to developing varicose veins simply because they're standing for long duration. The blood in their veins do not get back into circulation, and the veins get dilated over time. Over months and years, those veins get dilated and they get varicose veins. Pregnancy is a very common risk factor for varicose veins. It is a simple physics in pregnancy. The fetus or the baby is actually pressing upon the veins in the mother's tummy, and it is preventing blood from flowing from the legs back into circulation. That's a common cause for varicose veins in pregnancy. That is why we tell pregnant women to be active, to be moving around, and when they lie down, keep their legs elevated over pillows. Then again, recently we have come to the conclusion whether you sit and work or whether you stand on work or work, you're still prone to get varicose veins. You cannot cheat the system by telling I'm going to sit and work for long duration, because the venous pressure, the blood pressure in the ankles of the veins is quite high whether you sit or stand. Sometimes it reaches up to 80 to 110, 20 millimeters of mercury. It's that high. So it is recommended that even when you work for long, you sit and work for long durations, keep your leg elevated or stood for 10 to 15 minutes of every hour of work, or get up and walk around for about 5 to 10 minutes every hour that you sit and work. Age is a risk factor for varicose veins. So recently it has been thought of varicose veins has been thought of as a degenerative disease. Just like how our bones and our joints wear out and how our skin becomes lax as we grow older, similarly the veins also tend to dilate. They tend to become elongated and dilate. So it is now being considered as a degenerative form of aging. Obesity, overweight people by nature are prone to develop varicose veins simply because there is too much of fat in the system and too much of belly fat that prevents blood from going into circulation from the legs. Now, how do you diagnose varicose veins? So the picture in front of you is an indication of someone who has got very severe varicose veins. So those are the dilated veins you see in the leg, so that run under the skin. So at times you can see them as blue or purple looking veins, and sometimes they look like ropes or cord-like structures and within the legs, in the legs. So what do patients present with when they come with varicose veins? What are the symptoms of varicose veins? 90% of those with varicose veins come with heavy, achy or tired legs. Most of the time they come home in the evening from work, or in the evenings they find, or when they go to bed, they find that their legs are tired. They feel like kicking, like keeping on moving their legs or keeping on kicking their legs all the time. They get a lot of relief by keeping their leg elevated over a pillow. So those are the first signs of varicose veins. The other later stages of varicose veins Patients come with swelling of their ankles, swelling of their legs, burning sensation in their legs, or throbbing sensation, painful throbbing sensation in their legs. And if the varicose veins are quite advanced or quite severe, they can get itching in their legs, or they can get reddish or blackish discoloration around the veins, or they can even come with ulcers. Some of them come with bleeding from those veins. So, at what stage of varicose veins do you need or advise to see a doctor? If you see the swelling in your legs, and if it's a sudden onset, or even if it's from a long time, if you start seeing the color discoloration of your ankles and the lower part of your legs, or if you start developing ulcers in your legs where the discoloration is, please go and see a doctor for varicose veins. Now, when a patient comes to us, normally we investigate the patient. We take a general history of the patient. We take a history of previous surgeries on the abdomen. We take a family history. We take a personal history, whether they're smokers, because so smoking is one of the risk factors for varicose veins. Once we do the clinical examination, we come to a conclusion whether to proceed with further investigations. So in the clinical examination, we tend to examine if there are veins that are involved in the deeper veins, or which section of veins in the legs are involved. And we also do a quick abdominal examination to see if they have any swellings in their abdomen, because any swelling in their abdomen can lead to varicose veins. So the gold standard of investigation for varicose veins is what is called as an ultrasound Doppler study. It's a very simple study. It is done in about 20-25 minutes. It's a simple ultrasound study where we look at the veins. So when we do an ultrasound, we do it in various positions. We make the patient stand, we make the patient lie on their tummy like this. We make the patient lie down, we squeeze the calf muscles, and then we study. So the basic function of ultrasound study will give us the diameter of the veins, how big the veins are, how tortuous they are, whether any deep veins, that is the veins that are within the muscles of the patient, whether they are involved. So also we look for reflux. Reflux means any backflow of blood. Usually blood flows from the legs onto the abdominal cavity, onto the chest, and going back into circulation. So when the veins are very dilated, blood will flow in the reverse direction. So it flows from the abdomen, the chest, back into the leg. So we look for reflux. So there is a timing. We see how much the reflux is. Also, we look at what is called as the perforators. If there are veins connecting from the deeper muscular veins onto the superficial veins, and then we tend to identify how many perforators are there and whether they're incompetent perforators. So ultrasound is actually the gold standard for examination. There are other investigations we do for more complicated varicose veins, such as a CT venogram, but that doesn't come in this topic. So when a patient comes with varicose veins, we tend to classify them whether they should be treated or they can be left alone. That is a conservative management. So when a patient comes with early varicose veins, small little bulges in their legs, or they come with just heaviness of their legs, they feel tired in the evenings when they go back home. So we tend not to offer them any of the surgical intervention. So those patients do very well with lifestyle modifications. That is, we tend to encourage them to exercise, to be physically active, to go for a walk and come back. Lie down at rest with their leg elevated over a pillow. Even when they're sitting at home and watching TV or not doing any physical activity, we encourage them to keep a leg over a pillow or a stool in an elevated position. More important is to be physically active, take a walk, go for a walk and come back. So, and the next best thing is for a patient to wear compression stockings. So ideally, we give compression stockings that are class 2. So approximately that class. So these are graduated compression stockings that have got different pressures in different parts of the leg, different pressures in the foot, different in the ankle, and different in the calf, and different in the thigh. So most of the stockings that we prescribe will be class 2, that is anywhere between 20 to 30 millimeters of mercury pressure. So patients are encouraged to wear these stockings during daytime, at least for 8 to 10 hours. Wake up in the morning, wear the stockings after your shower. At night or evening before you go to bed, you can take the stockings off. Keep your leg elevated over a pillow. So that might prevent the varicose veins from getting worse. So these are recommended to be worn for about 6 to 8 months at a stretch, and then you can come back for a follow-up and see how you're doing about it. So the next step, what we do if the patient has come with stage 2, 3, 4, 2, 3 or 4 varicose veins, then we offer them some kind of a treatment. So now the latest treatments that are being offered are sclerotherapy, laser ablation or laser treatment for varicose veins, or radio frequency treatment for the varicose veins. So previously we used to do open surgery when we used to take small incisions and we used to strip off the veins. So those are rarely done nowadays. Maybe I do in my career, I do maybe 1 per year or 2 per year, because the indications for laser will not be there. So those have become, open surgeries are now become very, very rare and very, very outdated. So these are the compression stockings that I was talking to you about. So you might ask how the stockings work. So they help to squeeze your legs. So it is well known that there is a second heart in the legs, the calf muscle. So once it pumps blood back into circulation. So these stockings actually coordinate with the muscle. It tends to pump blood back into circulation, and it does help to relieve symptoms such as pain, heaviness of your legs, and feeling discomfort and tiredness. It gives quite a lot of relief. So we offer sclerotherapy to those patients who come with small little varicose veins. You might find a small segmental vein running in your thigh or your leg, small little varicose veins. So those patients will do very well with sclerotherapy. It's about a half an hour, 45-minute procedure. It is done under a local anesthetic. It is done as a daycare procedure. You can come into the clinic and you can go back home in a couple of hours. So after the sclerotherapy, we'll need you to come back for follow-up after a couple of days. Then again, we advise you to wear the compression stocking. So this is good only for small veins or for recurrent varicose veins. So some people, when they undergo surgery, they might have recurrence. After a few years, they might come with small varicose veins. So we offer a sclerotherapy for this. So there are not many side effects to sclerotherapy. Only thing is the patient can feel a little bit of itching or a bit of numbness when we inject the sclerosant. So again, this is done under ultrasound guidance. We do the ultrasound, identify those veins that need to be jabbed. So we put in a small needle and we inject the sclerosant into it. So the latest treatment that has come into for the treatment of varicose veins is the laser treatment. So now in India right now we have the most advanced lasers. So when I started my training, we had the older type 870 nanometer lasers. Now we have come to 1470, 1474 nanometer lasers, which are very advanced, which have got very, very few side effects, and the patients hardly feels that the procedure has been done to him or her. How the laser works is it actually heats up the water within the veins. So blood contains water. It heats up the water to a boiling point and it releases oxygen, nascent oxygen. So that oxygen irritates the vein wall and the vein tends to close. So it is called as a vein closure procedure. This is a non-invasive procedure. All it needs is a small needle, and then we pass the laser fiber into the veins, and then we fire the laser. So I've taken a video of a patient that I had done recently. So like I told you, I will be just showing you the video. Sorry. So this is a fiber passing through the vein, and you can see the marking already has been done. And the fiber goes all the way up to short of the seminiferal junction there. So there's only a small video, but I will be able to take some of your questions if you ask me any details. So this is an example of the previous surgeries that we used to do. We used to make small incisions, tie off those veins, and then physically remove those veins. And it's not a very good procedure. It's a very traumatic procedure. The patients are known to have more pain. Recovery is a bit longer, and then recurrences are well known after these procedures. So they're kind of being given up now, except for a few indications where open surgery is still being done. Like I told you, maybe I do 1 or 2 per year. So, how do you prevent complications from varicose veins? There's one thing is we cannot prevent the varicose veins from occurring or from disappearing once they occur. So they're there to stay. So to prevent complications of these varicose veins is to, like I told you, be physically active, keep moving around, don't stand for long duration, don't wear tight-fitting clothing because they can compress your veins, and use the proper footwear. Lifestyle modification is very important. Again, diet, exercise, and the regular walking can prevent varicose veins from getting worse or from bleeding. So this is a small presentation of varicose veins. I'm very sorry I could not come on the speaker immediately, but I'm willing to take any questions now.
Dear member, it's the question and answer session. So if anyone has any questions, can raise their hands and go ahead. We come to the end of today's informative session. I take this opportunity to thank Dr. Narendra Kumar Reddy for sharing his expertise with the members of Vayah Vikas. This talk was much needed and has given us immense confidence in understanding varicose veins. Thank you, Doctor. Dear members, we sincerely thank you for sharing your enthusiastic participation. We hope you found this webinar useful. Please stay connected with us as we continue to bring you more informative and beneficial webinars in the future. Have a great evening. Thank you.